Class, we will start the class. Maraming kita. Karag mo tawaran ng number.
Ikaw dyan.
Okay na ito.
Mapatil ko kuya.
Ako na kung i-mute mo pa rin. Pag-yaya kang good.
Pwede pa man niya.
Sayang ang sos.
Wala man ako dyan. Di mo gusto.
Ano mas?
Kaman.
Sabi kita mga paputo ko nga yung Marisa. Hoy! Doon. Ganda ko. Kuha na yun.
Nakamute.
Ngayon, ikaw nyo.
Ikuha ni Marisa. Private check-up pa ni. May kalungkutan ng check-up pa daw.
Okay. Yun na. Good afternoon. Psychiatric report. We'll be taking up our lesson, psychiatric report and medical record. So we have been taking up, when we say psychiatric report, it usually refers to the psychiatric history and the mental status examination. However, in this aspect, it goes beyond the psychiatric history and mental status examination. So you can see that psychiatric report covers both, I have said it already, both the psychiatric history and the mental status and psychiatric interview. So although you are already interviewing when you are doing the psychiatric history, but it means that we are not taking only the substance, but it includes body language when you are interviewing the patient. So that's why it is included psychiatric history, psychiatric report is a psychiatric history, the mental status examination, and the psychiatric interview. Also, what is psychiatric history? You know, that is a life story of the patient, how the patient was brought up. Like you haven't had any experience in your clinics, no? So maybe when you are in the second year, you will have your history at the clinic. So psychiatric history, how the patient, you have the outline in your psychiatric history. I gave it already to you, and you know the outline of the psychiatric history. So it means it is a life story of the patient, the medical, the psychiatric, and other relevant story of the patient. And until the patient had his psychiatric problem, mental status is the clinician observation towards the patient. So you cannot have a mental status examination if the patient is not around. Whereas you can have a psychiatric history even if the patient is not around. You can ask the relative, the significant others, but in mental status examination and psychiatric interview of the patient, you cannot do that if the patient is not around. So the patient should be present. The history or anamnesis describes life events within the framework of the life cycle from infancy. So as I've said, it is a life story from infancy, 0 to 1 year old, no, to old age. And the clinician should attempt to elicit the emotional reaction to each event as remembered by the patient. So when you are asking the patient, sample 0 to 1 year old, what happened on this area, on this aspect, when you are 0 to 1 year old, 3 to 5 years old, what are the important events? You know that 0 to 1 year old, that is the period wherein we are able to have our trust and versus mistrust. No? This is the time, no, that we start to develop our trust, not when we are already adult. No? So, coupled with that, after 0 to 1 year old, you have 1 to 3 years old. So what happened on that period when you are 1 to 3 years old? So what are the different aspects in your life, you know, that could affect who you are now? That is the importance of your history. You know? It means your past shapes who you are now. Then you have your mental status examination. It covers what the patient is thinking and feeling at the moment and how he or she responds to specific questions from the examiner. So the mental status examination means it comes from the patient. The observation of the clinician and how the patient answers and respond to the interview of the clinician. Nevertheless, the clinical should try the patient's own words as much as possible. So, as much as possible, we try to have the patient talk on their own words, and even when we write, it would be better that we place the word how the patient said. Especially when there are symptoms of the patient, like hallucinations or delusions, or even if the patient is irrelevant, even just with the chief complaint, sometimes the patient, you will ask, okay, wait, why were you here? Why are you here? Ambot ira, kay hirat may mga siraulo, no? Or sometimes they will talk like that. So you have to write it down because it becomes a progress notes. Why? By the second time or third time when the patient comes to you, the patient can already, or is already relevant, and they will say, I am coming here because I am taking the medicine in order that I will improve. Before I was not able to go to sleep, I cannot sleep. I had problems, I had hallucinations or illusions. So the first time that the patient comes to you, it would be better that you really have to, as much as possible, write the patient's own words. Because you will know that the patient is improving or not. Because if you will not write, especially on his or on her own words, you will not know that the patient is improving. At least when they come back, they are already improved and they can already respond. The psychiatric report includes more than the psychiatric history and mental status. It also includes a summary of the positive and negative findings and interpretations. So your psychiatric history and mental status examination, as it is said, this is a part of the psychiatric report because you are involving the weaknesses, the positive side of the person, as well as the negative side of the person, not necessarily the bad side, no? at least we will know what are the good things that the person has, or what happened, why did he get sick. So that is the importance of your psychiatric report. Not necessarily that you are deducing a bad side of the person. No. Behaviorally, psychologically, and how the patient interacts or relates, especially in relating with other people. So that is the importance of your psychiatric report. The medical record. The psychiatric report is a part of the medical record. However, the medical record is more than the psychiatric report. Why? Your medical record covers all the relevant as well as irrelevant part of the patient history. How the patient has been brought up, how he went into his adolescent, when he became adult, when he got married. No? So your psychiatric report is just a part of the medical record. But your medical record is more than a psychiatric report because, as I said, there are other things that are being written there in your medical record. For example, the medical record, what time or date did you have your consultations, no? The way you relate, no? Your behavior when you had your checkup. So it is being written in your medical record. So that's why when you go to the hospital, medical record is very important because it is there that chronologically, no? It can be seen there how you had the result of your different consultations in your medical record, including your psychiatric report, including your medical problems, and everything is being there when you go to the hospital. So that is the medical record. So that's why it is more than a psychiatric report because it reveals not only the psychiatric problem, but as well as other problems behaviorally, medically, and other aspects that is very important when you go to the hospital. Even your laboratory examinations, your x-ray, it is being revealed there in your medical record. So it is a narrative that documents all events that occur during the course of treatment, most often referring to the patient's stay in the hospital. So even if you will not be admitted, your medical record is still important. So sometimes when you go to the hospital and there is a long line, no, it seems that you become impatient waiting to get the medical record. But with the advent of this electronic medical system, it becomes easy for us to already access the records of the patient. Unlike before that, you really have to get long history and you read, you write. No? But here, with the advent of this electronic medical system, you can just access in your internet. No? The problem is sometimes if you do not have if you have poor internet connection, that is the problem. But it is there, even if it is said there that patients stay in the hospital, the more that it is very important because how you improve when you are inside the hospital, when you are admitted. But nevertheless, even if you are not being admitted, your medical record is still important, as I've said, because it shows the different events of your going to the hospital. No? As I've said, the laboratory, how the result of your x-rays, CT scan, and other radiologic aspect of your examination. It is being reflected in your medical record. It is said there that progress notes record every interaction between doctor and patient. Reports of all special studies included laboratory tests and prescriptions and order for all medications. So you can see that medical record, as it said, it only not covers the psychiatric report, but it becomes also up. Your progress notes is being also reflected, and your interaction between doctor and patient. How is it being written there? So sometimes the doctor will say, the patient did not answer when she was interviewed, or the patient was so sad when during the interview, the patient was crying, or the patient had some pains, complaining, stomach ache, headache, and the result of the laboratory is being reflected in your medical record. And even the prescriptions, the medicines that was given to you. And of course, the orders for all the medication that is being prescribed to you. No? Even also the nurse's notes, it is also being written there in your medical record. So the medical records, it is not only the report of the doctor and the patient, your history, your interview, but you can see it is also reflection of the nurse's findings on the patient. Because nurses have their own notes on the records. They will get the temperature, of course. They have other kinds of reporting. I know some of you are nurses, and you know that, how you notes at the medical records. The medical record tells what happened to the patient since first making contacts with the healthcare system. So that is why we said that it is like a progress notes. Because at the first, of course, when the patient comes to you, you can see that the patient has some problems in medicals, psychiatric, surgical, and other aspects of medical problems. It is being also revealed there. So how you started, for example, when you first see your doctor, you had a problem of medical problem. For example, you had headache. So it is being reflected there. So what are the medicines that was given to you? So then after how many months, you again visited the hospital or the doctor, and you had another complaints, like for example, stomach ache, epigastric pain. So you had an operation for your epigastric area. So it is also being reflected. Everything is being reflected in your medical record. That's why it is more than a psychiatric report, because not only psychiatric report is being reported there. So it concludes with a discharge summary that provides a concise overview of the patient course with recommendations for future treatment if necessary. So you can see sometimes that when you, especially when you go to other hospital, you ask and when you are already going out, discharging from the hospital, what is being written in the discharge summary is what has been transpired at your medical record. So the doctor just would write what has been written at your medical record. So she can make or he can make some recommendation for some management. Like for example, treatment, if it's very important that you will be treated or operated. So that is also a part of your medical record. So very important. So do not lost your numbers in the hospital, because it's like progress notes, a history of your medical, surgical, psychiatric report. It covers there at the medical record. So there shall be an individual record for each person admitted to the psychiatric inpatient. Patient shall be safeguarded for confidentiality and should be accessible only to authorized persons. So you know that the medical record is very confidential. Even the circle of confidentiality, even parent is not a part of the circle of confidentiality. Who are a part of the confidentiality, of the circle of confidentiality? Meaning to say, who can only access the medical record? The person who is treating you, the supervisors in the particular area, the doctors who is handling you there, but even the previous doctor is not anymore a part of that medical record, your current medical record. He cannot see anymore. That is already beyond confidentiality if she will or he will still see your current record, because he is not anymore a part of the medical record that you are currently taking or is having when you are admitted in that particular time or date. So it is a legal document. Why? Why it is a legal document? It is a legal document because, for example, some of the patients are having accidents. So you will go to the police, and of course, it will show there how the management was given to you. So if you were being operated, it reflects there. So it is an evidence of your medical problem. So during the reports, and you will give the findings, doctors will give the findings, so it would reflect at the medical record. So the police, or any insurance, you can get the evidence through your documents on the admission documents. So that's why it is a legal documents. Your medical record is your legal documents. It's very, very important. So that's why not anybody, even your parents, is not a part of the medical record of the circle of confidentiality. Identifying information on the individual and family. So you can see that even if you are alone going there, but it would also reveal your being a person and even your family. So it is reflected how you were brought up. For example, your family, you had a chaos family in a psychiatric side, or even sometimes there is some chaos in the family, so that's why there is a legal problem among the family, pathologic family. So that is a very informative written record or report, your medical record. So it's very confidential because even your family is being recorded there. especially when you are in the psychiatric side. How you relate to each other, how you had an interaction with your family, it is being there. So as I've said again and again, it is very confidential. It is a source of referral, date of commencement of service, and name of staff member carrying overall responsibility for treatment and care. So as I've said, you can see there who are the persons who handle you, who treated you, who was there when you were sick, who are the members, who are the staff when you were critically ill or when you were admitted, who are the person surrounding there. So it is also being reflected there. So it might be when somebody would try to have a problem, would try to sue, no? So the persons there, their names are also being reflected on the medical record. So again, it is very, very important. So you can see that that is not only you that is written there, but the family, the staff member, the doctor who is treating you, and other relevant staff members during your treatment or your being around in the hospital. Initial, intercurrent, and final diagnosis, including psychiatric or mental retardation diagnosis in official terminology. So you can see that everything is there. The diagnosis that you have, it might be psychiatric or it might be some problem, developmental problem. So it is being also reflected there. So that's why sometimes MR, mental retardation, no? So it is being reflected there. And not only the final diagnosis, but even initial diagnosis. It also being there. Why? Because your initial diagnosis might be given. No? The doctor who will take charge of you will have already an idea that before you had an initial diagnosis like this. So this is a lead. An initial diagnosis is a lead to another diagnosis. It might not be your final diagnosis, but sometimes, at other times, your initial diagnosis becomes a lead diagnosis of other illnesses that can be found later. Reports of all diagnostic examinations and evaluation, including findings and conclusions. So I told you that the diagnostic examination, the laboratory examination, the CT scan, the MRI, all the findings is always reflected there, and all other findings and conclusions. It may not always be the correct, no, the appropriate, but at least the doctors had some initial findings, had some conclusions based on the interview, on the diagnostic results, and other diagnostic evaluations. So it is always related or relevant to other examination, not only the interview, but other examination that is connected to you when you were examined in the hospital or from your doctors. Reports of all special studies performed, as I've said already, your X-ray, your clinical laboratory test, your clinical psychological testing, your EEG, your psychometric test is being reflected there. So somebody asked me, how is medical findings related to the behavior of the patient? So I said, it may not be a psychiatric finding, it may be a a medical problem, but that medical problem can have some effect in your behavior. For example, you have some problem of, for example, let us say, cancer. That is the special study. You have a tumor in the brain. So what happened? Psychologically or psychiatrically, you can have some problem of you cannot go to sleep, you can be sad, you can be depressed. That is the consequence already of your medical findings. No, not necessarily that psychiatric problems is always a result of psychiatric illness. No, there are medical problems that could reflect psychiatric findings. As I've said, I'll already give you an example. Or some patient, for example, those who went into stroke, some patients could have a problem of gait, walking problem. Some patient could have some stuttering, no? Some patient could not talk anymore, no? So that's reflecting psychiatric problem or neurological problem from your medical problem. So we already discussed before that psychiatric problem is a part of your surgical problem, medical, and other problem that we had when we had some pains in our body and other manifestations that we do not feel good. The individual written plan of care, treatment, and rehabilitation. So medical record will entail also the plan of what the doctors will do in order to carry out the treatment and how would they go when you are already well. So would you need rehabilitation? So that is why everything is being written in your medical record. Then you have progress notes written and signed by all. You can see that everything is. Ayan, ano na yun? Nawara ako. Nauna na. Ito pa. Ayan. Ipakadila ito yun. Nadila. Amo na. Sige, okay. So, progress notes written and signed by all staff members having significant participation in the program of treatment and care. So you see that not only doctors, their name is not the only being reflected, but also the names of the staff involved, the nurses, nursing aide, and everybody who was involved or who were involved in the treatment, no? In doing some patient care, the nurses, no? It is written there, no? Their names are being written there. Summaries of case conferences and special consultations. For example, if you are being referred to another doctor, you had a problem of, for example, pain in your ear, so you will be referred for a special consultation. If you will be admitted as having problem of chest pain, and then you have a problem of headache, so you will be referred to neurologic side of specialty. Dated and signed prescriptions or orders for all medications with notation of termination of dates. So in the medical record, you will see also the prescriptions or the orders. For example, continue medications. Please insert IV for blood infusion or blood transfusion. It is being stated there. Or you have to terminate the blood test because the blood transfusion because the patient is having some manifestation of adverse reaction. So it is written also there. Whatever is the, what you call that, events, it is always written in your medical record. So the first time that the doctors will say, or anybody, the consultant, they can easily see what happened in the ward, what happened the course when you were still at the hospital, what happened when you were still being treated. So the nursing aide, the nurses, everyone is being involved because they have their signature there. So until the termination of your medication or until you discharge. So medical record is not only used by physician, so you can see, but it is also used by regulatory agencies and managed care companies to determine length of stay, quality of care, and reimbursement to doctors and hospitals. So by now we have some PhilHealth, so sometimes the insurance companies, so it's very important. So they, these are the things wherein we try to have the breach of confidentiality, especially when you have your PhilHealth, because your illnesses, your diseases being reflected because of your insurances. You can be paid by the company, by the PhilHealth, so that's why there is sometimes breach of confidentiality because of financial aspect. The inpatient medical record is accessible to authorized persons only and is safeguarded for confidentiality. So even though if the company are the one or would take your record or would Xerox your record, they are bound, they are responsible for if somebody would have some claims or some legal complaints, they will also be charged because they were the one who got your records. And why did they have to show it to other person instead of they alone could see your records? So that leads to chaos of your life. So it is being safeguarded, although there is breach of confidentiality because of your finances, of paying your PhilHealth or other insurances. So you see there that medical record is also crucial in your malpractice litigation. Why? Why it is crucial in your malpractice litigation? Because it is being reflected, especially in the United States. If there is some negligence of the doctors, not only when the doctors made a mistake, but when the doctors had were not able to give you the proper medication or were not able to give you what that diseases would need or what that person, that patient need, and you will not be given. So it is a malpractice litigation. It is not only when they made mistakes, but it is also a malpractice when the doctor was not unable to give what you should need, what treatment you should need, and it was not given. It is a malpractice litigation. It is not so much here in the Philippines, but in the United States, that is very crucial, and very important. So that's why some doctors, there is always having some, the doctors would pay the patient. So, as I said, your medical record is composed of your psychiatric report. And as I've already said that it's not only a psychiatric report, but since you are into psychiatry, you can see how we again try to reminisce the psychiatric report. You have your psychiatric history, identification, your chief complaint. As I've said, your chief complaint should be in the words of the patient. For example, as I've said, if the patient would say, hindara ako nga kay maglabadira. So you have to write it there. Hindara ako nga kay maglabadira. And you have also to write the chief complaint according to the caretaker or according to the significant others. Identification. Who was with you? Not only your name, your age, your address, but in identification, it is also being written there what area were you brought at the emergency room, were you seen at the emergency room, at the outpatient, it is being written there. Or whom was your caregiver during that time, your accompanying person. So it's being written in your identification also. Or you have some scars, it's also written there. History of present illness. So you know that already. History of present illness, for example, you had some problem of having relationship with your work, with your coworker. So what happened before that? That is history of the present illness. You had some fight with your doctor because you had your coworker because you have some hallucinations. So you have to go back first. What happened when you were still well? For example, you were not able to go to sleep because you were given some assignments in your work, but it was very hard for you to answer. So you have some sleepless nights already until such times that during sleepless nights, you have no any more appetite in eating and going to progressive severe manifestation until such time that you had your hallucinations already. Your history of present illness is not just a patient had hallucination one day prior to admission, the patient had hallucinations. No. It starts what happened before you had your hallucinations or delusions. As I've said, if you are, for example, if you are a married woman, you have to write there that you had some argumentation, or you had a conflict with your husband until such time that your husband left you and so forth and going on until such time that you have your hallucinations and delusions already. That is your history of present illness. Not that when you make a history, you write immediately the symptoms. No. You have to write, you have to go back to what were the precipitating factors that lead you to have your delusions or hallucinations. That is your history of present illness. Not anymore, not immediately your symptoms or manifestation. Past psychiatric and medical history, of course, your past psychiatric, for example, were you admitted before? When is that? What hospital? How long have you been admitted? That is past psychiatric. What were the medications that you take? Until now, are you taking the medicines? No? Because some patients would say, "Ay, doctora, I was just given for a hypnotic drug, a sleeping pill," which is actually is not. But now the patient is again having some problems of violent tendency. That is past psychiatry. No? You have to ask, to know whether the patient is still taking the medicines or irregularly taking the medicines. Or if just you like to give the patient the medicines. Because they cannot accept. Some patients could not accept that they are psychiatrically ill. So that's why they have poor compliance of the medication. That is past psychiatry. It's very important. You have to know that they have been admitted. Some of the patient does not tell the doctors, but of course the doctor should always ask if you have a past psychiatric illness. Sometimes patients will say, I can open naman na, doctor, I was very well already. And now you have a relapse. But if you had continuously had the medication, you will have no relapses. No? I know when the patient would have relapses because they stop the medicine. They will only tell you, ay doktora, kay gitiba na naman, we reduce the dosage because she's already very well. No? And many times I tell the patient that do not reduce the medicine or the dosage until the doctor will tell you to reduce the medicines. But some families would insist that, ay doctor, my patient is very well already. So it's very, very important. The past. The past shapes the present, will make the present. Then you have the medical history. Medical history, if you have been admitted for some problem, chest pains, or having some strokes, that's medical history. So what are the medications that was given to you? Until the present, currently, you are still taking the medicine. It's very, very important because there is some cross-current effect of the medicine that you take, and again, the doctor will give you, and you are taking another medicine. You have to tell the doctor that you are still taking other medicines because there are sometimes effect of the medicines that you are taking. Not that you will follow what your neighbor is taking. Because doctora, my neighbor had some problems of sleepless nights, so they give also the medicine to me, like this medicine. You do not know that that medicine is an antipsychotic or antidepressant because they will only tell you that, doctora, this is for sleeping problem, but you do not know that it is a antipsychotic or antidepressant or a psychotropic drug. So that's the very importance of your past psychiatric and medical history. Then you have your family history. We have taken this up, but I just want to review to you that in your medical record, this psychiatric report is being revealed. Family history. Why is family history very important? Why is it? Diba? Family is the foundation of society. So because of pathologic families, it starts there. We have some problems. You know that when a person is being left before 11 years old by the mother or by somebody, their parent or significant others, the patient would usually have some depression before 11 years old. Family history, or sometimes pathologic, parents are not around, chaos in the family. There are problems already in the family about relationship in the family. I will not elaborate, but at least you know why family history is very important. Sometimes your close sisters or brothers just left. You already had some depression starting there. These are the importance of your family history. It's very, very important. As I've said, family is the foundation of our society. Personal history, your anamnesis, your early childhood, you know that birth through age 3. So what covers there? Your trust, 0 to 1 year old, 1 year old, your, what you call that, how you were able to have some curiosity at that time, no? Prenatal history and mother's pregnancy and delivery. So prenatal history, whether your mother had some prenatal, when you were still in the womb of your mother, and during your prenatal history, your mother was smoking or drinking. So when she delivered, there are problems of congenital anomalies. So that's prenatal history, no? And mother's pregnancy of delivery. So sometimes mothers, or some of your mothers already, there are problems during pregnancy. No? So that's why when you were born and when mothers delivered, there is some small age gestational problem. Two small babies. No? There are problems like that. No? Feeding habits, sometimes that is malnutrition. Especially in our areas, in rural areas, they will just be giving biscuits all the time, no milk, no. So there are problems of feeding habits because of some finances, or sometimes parents are not educated. So what they want to eat, they will give to their children. So their children become malnourished. They thought that children who are very chubby, they thought that because they keep on giving biscuits and even just whatever they want to, all carbohydrates, and the child is already very fat. So they thought that the child is not malnourished, but the child is malnourished because there is not complete nutrition. It is a misnomer that some of us would believe that when you are chubby, when you are fat, it means that you are healthy. No. It is already a problem of malnutrition also. So like the child, feeding habits. So early development. So early development, how the child was being developed or brought up during when she was growing up, or when he was growing up, how he was treated, how he was, there is sexual molestations, there are physical molestations, no? During early development. So when they grow up, there are problems, psychiatric problems. So toilet training, how old was the child was toilet trained? Sometimes you have a very rigid toilet training. So what happened when you have a very rigid toilet training? You become obsessive compulsive personality. It's like that. During that time when there was no, what you call that, diaper, our parents would tell us to move our bowel anytime, especially when they were about to go to sleep. So, or when they want to rest, we'd let them, children would let them try to urinate or move their bowel, even if it's not yet time. But now you know that toilet training, there is really an age that we have to be trained in toilet, going to the toilet, and not merely just have to punish the child when the child have a messy in moving their bowel anywhere, because that is time wherein children have some false movement, no? Or development, because at this time they are not yet so very like adult. Even if we adult, we know that's strong, no? So they are not yet trained. So there is a time when the patient are being toilet trained. And how old that child is being toilet trained? 3 to 5 years old. I think it's a toilet training time. No? Symptoms of behavior problems like nail bitings. No? So that is a problem of behavioral problems. What else? Sometimes there is trichotomania, wherein the child will keep trying to pull their hair. No? So they need attention. Sometimes the child are having some kleptomania. So those problems, those are diseases, psychiatric problems. It can be treated. Kleptomania can be treated. You just bring your child to the psychiatrist, but it is continuous. Of course, it would take time, but kleptomania can be treated. It is an obsessive compulsive problem. You have then your personality and temperament of a child. There are child that would only cry every time. They are very uncomfortable. No? So it would reflect also the parenting. Sometimes parents are so busy that they could not give attention to their children, especially in this time that all of us are very busy. No? So what happened? The child keeps on crying every time you're around. So you keep punishing your children, but only to find out that the child is just wanting your attention. No? So you keep on punishing until the child is having some trauma already, and when they are growing up, the more that their symptoms become severe. So those developmental problems can be treated, except your mental retardation and your autistic behaviors, because those are developed when you are still at the womb of your parents, of your mother. But other behavioral problems, kleptomania, some temperamental child, it can still be treated. You just bring it early in their development a psychiatrist. So middle childhood, that is ages 3 to 11. So it includes there your skills and development of the child. So 3 to 11, at this time, the child has the focus of the mind is at school, if you are there to guide the children. But if most of the mothers now are going abroad or going far to their children because of financial aspect, otherwise they will tell their children, if I will not leave, you cannot eat. So I'm having sacrifices to be not around, not be with you because of you, so that you can eat. But it's a problem when the mother goes back, your skills was not developed, your talents were not developed. So what happened when they comes back? So they do not have any more interest in going to school. It lapsed already. Because during the time that this period is the time of your talents and abilities that should be developed, nobody was there. Nobody was assisting you. The father is drinking. The mother is not around because looking for money. So where are they? So where were you? So your talents, your abilities were not being developed. So when they comes back, you're already in high school, so you do not have any more interest in going to school because your skills were not being developed. You have no more interest. And then sometimes parents would blame you. It's not the way. Then you have later childhood, pre-puberty through adolescence, peer relationships. Sometimes there's gap between parents and children, especially nowadays. Before, when we go to see show outside, but now it's already, due to the pandemics, it's a little bit limited. But before, you want to see some show, dance, outside. During that time, our time, start at 6 o'clock, you can go home at 9 o'clock. But now it starts at 10 o'clock and you can go home at 2 o'clock or 3 o'clock in the morning. Sometimes the parents could not understand. There's a gap. So you have peer relationships. So in peer relationships, sometimes those children who have the same, let us say, issues and concern. For example, somebody, some children have problem of tension, or their parents are not around. So what do? They go on drugs, they go on drinking. So for those people who are having the same parents would tend to group together because they are the one who will understand each other. Those children that, or those adolescents that has been being brought up with a good home, they would not understand. No. So birds of the same feathers are birds, no? Because they understand each other. So I have observed that when some of my patients who are a problem of curiosity on taking drugs, they can easily be managed. But for children who have problems, have pathologic finally, when we treated during the time when they will take drugs, it is very, very hard or difficult to treat. But if it's out only of curiosity and they can be brought immediately to the doctor, it is easy to treat them. So school history, for example, during their elementary days, how old were they were enrolled in grade 1. Some parents would not know or even understand that their children is mentally retarded. No? I told you before that I have patient. The child was brought to me. So when the child was brought to me, the child has some problems of blank stares, and the mother would tell me that, oh, Doctora, my child is a very bright child. No, he is so diligent. He was always studying. But suddenly, when he took the examination, in CE before, he was not able to pass. He studied up to early morning. But when I examined the patient, when I interviewed the patient, only to find out that the patient is mentally retarded. Because some parents, they thought that the child is just normal to them, no? That they cannot answer, but he keeps on studying. So how can you pass even if you study up to 3 a.m., up to 4 a.m. because you cannot understand, no? Because he is mentally retarded. No? So when I asked the mother, so how is he for your other children? And so that is the time that the mother will tell you. The mother will say that, oh, Doctora, as compared to my other children, this child of mine got a highest grade of 75. So you will already know that even in grade 1, you will already know that the highest grade is 75. Of course, because the child, until such time that when he is already going up, no, he cannot anymore cope up the reality. So that time, the manifestation would come out already. So through the school history, you will know already how the child is or was. No? So cognitive and motor development. So that's why sometimes we ask, how old the child was able or is able to walk or talk. No? Because in your developmental period, you know how old the child can walk. Even 8 months, they can start already walk, 7 months, no? But sometimes the mother would say, oh, Doctora, she was able to walk at 6 years old or 5 years old. So you have already an idea the motor development of the child. No? Sometimes the child would say, sometimes the mother would say, Doctora, the child, I would sometimes let the child go on errand, and I have to list the things that he would buy because he cannot memorize. So the mother thought that the child could not memorize, but there is a problem of cognitive and motor development. So you have to be very digging out, no? When you go to the development of the child, because from there, because the mother or any other significant person would not voluntarily tell you that, oh, Doctora, my child is like this, unless you will not ask them. So it's very important that you have to ask how they develop and how was their behavior when they were growing up. Particular adolescent emotional or physical problem. So adolescent, I have a patient, he could not, for her, she was so conscious with what people would tell her, would see what she was doing, and she worries immediately. So when I asked the history, only to find out that she doesn't like the way they were brought up because her mother was always talking and talking and talking, and she could not anymore cope up. She could not have some peace at home. So the child would has some intention to go on suicide. But I was happy because she came to me. She was telling me how she was brought up, but she was closer to her father. So good that there is somebody who can neutralize. But if there is a pathologic problem in the family, it's very sad because the patient has a problem of they cannot cope up anymore. It's very important that the family should be very supportive to the child or to the patient. They thought, some parents, they thought that all medicine can give anything, can cure everything. When you brought it to the psychiatrist, no, it's not. The support of the family is very, very important. Sometimes family have to be secretive with the problem of their child. It should not be. It is stigma to the society, but now it's not anymore. I was happy sometimes that one of an adolescent came to me, just cry and cry in front of me because she had a breakup with her boyfriend. I appreciate that. Rather than going to the psychiatrist when he or she has already had hallucinations or delusion. She just told me how she was being treated by her boyfriend. She was physically abused by her boyfriend. Boyfriend pa lang niya, but she was physically abused. But she was hurt, but she still cling to her boyfriend. Because when you are physically hurt, when you are hurting somebody, it makes you more closer because that physical abusing, that sexual molesting is a part of being closer to somebody. Parang it is an energy that make you close to that person because of physical abuses. But if you are given in an environment with a physical abusive boyfriend or not a physical abusive boyfriend or friends or parents, of course the child or adolescent will choose the peaceful environment. But I told you before that I have a patient that she thought that love was pain until she got married already. That person, she's a female. She was brought to the social worker, this WD. She was staying there. So when she was still a child, her parents separated. So where did she stay? She stayed with her aunt. And her aunt, she had done a lot of work there. So many. She cannot carry the work that was given to her. She was again physically injured or abused until sometimes that she was being transferred to another relative. By there, she was sexually molested by her uncle. So until this time that when she grows adult already, she got married. When she got married, she was again physically abused by her husband. And so that's why he was brought to the social worker. And when she was in front of me, well, she was already telling how he was brought up, what were the things, what happened to her. She was crying because she realized that love is not pain. She was the one who realizes that love is not pain. Before, she thought that love was pain. Because, of course, when she was brought up, her mother and my father separated. Then he stayed with her aunt. There was physical abuse. And there he was stayed again with her uncle. There was sexual molestation. And when she got married, she had again physical abuse. So she thought that love was pain. And when she was already talking to me, she realizes that love is not pain. So parang I was also touched because at the start, that was the how she knows that love was pain. From the very beginning pa lang, she feel that love was pain. So another psychosexual history. Psychosexual history is very important, but of course you will not dig psychosexual history if there's no problem of sex, no sexual molestation. Of course, you have to ask, how was your development? Did somebody stay in your house? A houseboy, or you have a houseboy in your house, like that? Because I've told you already that I have also a patient that the mother brought to me because she has a nightmare. The presentation was just a nightmare. Yeah, it's not in the book. So when the patient was brought to me, she was already grade 5. They had a houseboy when she was grade 2. So her parents, both of her parents were working in a government assigned at the field area. So who was with them was the houseboy. So of course she was the eldest, I think eldest or the middle one, but she was already grade 2. She was sexually molested. But of course she doesn't know that that is sexual molestation. She doesn't have any idea, no, that that was an advantage, no disadvantage to her doing by their houseboy, until the time that she was brought to me because of nightmare. So when I interviewed the patient, only to find out that she was sexually molested. So the mother at first did not believe. So I was really having some gut feeling that the patient has really sexually molested, no? By the houseboy. The houseboy anyway was not there anymore. So I brought the patient to the OB department and have an examination. So there was already a broken hymen, like that. She was already grade 5. So the presenting symptom was only nightmare. So I'm just telling you that not all in the book you can find is not the presenting symptoms, no? It's not the proper symptom that you would expect, no? It was just a nightmare. But later on, I found out that the patient is having a problem of sexual molestation of their houseboy. Their houseboy was not anymore around, no? So anyway, I'm just sharing you the different manifestations of a person, no? When you have some advances, sexual advances, physical advances, no? So there is really behavioral problem that would come out. Then religious background. Religious background is sometimes in a family, we have so many religion in one family. So what comes out is chaos. Why? For example, the mother is a Catholic. So here comes a child who is already what they call that, Iglesia ni Cristo or other religious affiliation. So of course the mother will have so many saints at home. So when the mother was out, that girl throw out all the saints in the house. So when the mother comes back, she was surprised why she has no more. The saints that she had been collecting was not around anymore. So they had some problems, they had some conflicts, arguments. No? There was also a time wherein I had a patient that she was able to enter a cult. No? So she has been living there for almost 1 month. She was only given milk to feed there, because it is a sin if they will eat this and this one. She was very thin when she comes out, because it was not enough, because there were many inside that cave. It was a cave, so they have some pastor there. So that is some religious problem. So if you will ask, it is very important also. So I just want to tell you that all these things are very important, even just religious background or problems, background of the family, you can see already that it can cause behavioral problems, or even depression, or even psychosis in a person. So adulthood, adulthood. So this is just a review, adulthood. So this is a part of your examination, your psychiatric history, your mental status examination, the later, what you call that, lecture that I have, but it would start from the psychiatric history, from mental status examination. It would start there. Then you have your adulthood, occupational history. So we already discussed that sometimes you are into not proper work. You are a nurse, but you are working in a bank. Sometimes, so during the examination, you cannot answer anymore. Sometimes you are being scolded by your boss. Your nurse is not coincide with your work. That's an occupational history. Or sometimes you're overloaded with your work. Not being lazy. Overloaded. Sometimes you do not, when you are already there, because you do not want your course, sometimes you do not have the, the initiative to work, because it is not your chosen field of work. So you were fired, you tend to hop from one work to another. That is occupational history. So there are many things that could affect the person's behavior. And these are the things. You can see occupational only. Sometimes you will say, oh, it's occupational only. So why should it affects your psychiatric? Why? Because not all of us, it depends on the vulnerability of a person. I told you there are predisposing factors. What are the predisposing factors? Your age, your race, your gender, also your vulnerability. So not all patients will manifest what others will. Why? Because we have also different strength. We have also different pathways when we were growing up. So how can you compare others, that others break down, and you did not? Sometimes you will say, oh, Doctora, they just have a breakup with their boyfriend and she got immediately into breakdown. No, you cannot say that. Because when you were growing up, you have a different, as I've said, road to traverse. Maybe that person has a problem of family, while your family was intact. So you cannot judge to a person why he breaks up and you did not. You're just lucky if you did not have your breakdown because you have the full support of your family. But some persons have different strength. We have different weaknesses. And so we should not be judgmental. So you have your social activity. Your social activity sometimes is being also affected by our family. So some of our family, when we are still a child, we are not supposed to expose to the visitors. We are not allowed to talk to them. Some families would accept that children would entertain the visitors. So what happened? When you are growing up, when you're already interrelating in your work, it is very difficult for you to socialize. You cannot cope up the jokes. You cannot cope up the corrections that your boss will have to you. Why? Because you lack you lack relationship, interrelating. When you were still a child, you have inhibition because of how you were brought up. So that is social activity. It depends on how you were brought up. As I have said, for what you are now, it is because of what you were before. Unless you have to rationalize yourself, you have to realize yourself, you have even to practice yourself how to socialize in a better way, that you will not be, sometimes you are introvert, we easily get hurt. So it differs from person to person. As I've said, it reflects in our childhood development until adult, until we become old. And we become old, it is difficult for us to become old because we cannot accept anymore that our weaknesses, like that. Adult sexuality, of course, some people are pedophiles, like that. How you were treated, you work, sometimes people work in prostitution to find money, but you did not know. I have interviewed also a person, somebody, she was crying. I was touched. She was crying because she got married. Maybe she got married a foreigner, but she got married when she worked in Subic Bay, somewhere in Manila. Well, she was related. She was psychotic. So when I interviewed, so I was able to get in. She was crying when she was telling me how her life was. She hopped from one man to another, how she worked in a prostitution just to live, just to make a livelihood. So I said, people should not really judge people going into prostitution because you do not know what really they feel when they are a prostitute. It was very hard. She was really crying. She was hurt what she was doing, but she doesn't know what to do to make a livelihood. So she enters into a prostitution, and she even described to me how she was able to cope up when she was into prostitution until she got married. I don't know if she had a good marital relationship now, but she got married into a foreign from UK. But somebody, she was just referred to me. I don't know why she was referred to me because she was taking drugs. So when that doctor referred it to me. So when I dig the history, she got into prostitution. That's why she was able to relate to me how it is to be a prostitute. And so she was crying. You know? So everybody, all of us should understand, and every move that we have and every behavior that we have, it is always a consequence of some pathologic or many other events in our life. Then military history, of course, military history, if the person, you have to ask whether the person has an experience of military work. But if the person has no history in military, of course, you do not have to call that, go so much on that history. Then you have your value system. No? What is your value system? Of course, you have to ask in your family whether your family is liberal-minded family. You are open. You can open to your family, to your parents, about your boyfriends, about relationship, no? Or whether they are conservative. No, that is value system. So that's very important because sometimes it hurts you, no? When you are already going into your own family, and of course your partner is not the way your family, the way you have been treated, it is harmful. No? It becomes, you are hurt. No? I was listening last night with Alex Gonzaga. No? She got married. So the first time that she got married, what was their conflict the first time? So her husband revealed that Alex bought a bed that he doesn't like. So because Alex Gonzaga bought a bed that there were some stars, and then her husband said, "I cannot go to sleep in that. It's very feminine." So what happened? Alex, sell that bed. We said, and the one who Boy Abunda said, were you able to sell that bed? Yes, I have to really sell that bed because my husband does not want to sleep beside me. Because her husband does not want a very feminine bed, no? There were stars, and Alex thought that her husband will appreciate. So what I mean is, not all of us are exposed to what we have. So that's why during marriage, you have really to, to blend your differences. Because for them, it may be good, or you feel good, but for him, they did not feel good. No, it's just a bed. No? But they were having some conflict. Can you see that? No? Can we expect that it's only a bed that they have conflict because the husband does not like the bed because there are stars? It's too feminine. So these are the things that affect us. So that's why we have some, especially when you are married already, you have some conflicts, petty things, because you do not understand each other. It does not always say that you have to follow what the others say. You have to blend each other. So it's very important, value system. Then you go to your mental status, your appearance, So you have to describe the person appearance, whether the person is dirty or the person is sexy, or the person is very clean, no? So that is description of the person. Whether the behavior, the person is hyper, and or psychomotor activity with slow-moving person, general description, well-dressed, no? So you have to describe that, no? With long nails, no? You have to describe the whole of what you see in the person. That is the appearance. Speech, whether the person is hyper-productive, very talkative, no? So you do not have time to ask, no? That person, so that is speech, no? Hyper-productive speech. Mood and affect. Mood is sustained emotion, no? Affect is the reflection of the mood, the external emotional aspect of a person. That is affect. So mood and affect should jive. For example, mood. So mood, when somebody died, no, 2 weeks, so it means that your affect should be sad. But if you are always laughing, so there is no, the mood and affect is inappropriate. No? It does not jive. Your mood does not jive with your affect. Then the thinking and perception, form of thinking. Form of thinking is how you make your sentences, how you make your phrases, no? Form of thinking. No? The flow of your thought, that is form of thinking. Content of thinking means what is, if you are preoccupied sexually, if you are preoccupied with delusions that you are the Messiah, that is content of thinking. Thought disturbances, if there are many things that comes into your mind that you cannot control. For example, that somebody can read your mind, that you are, that Obama can read your mind, so many things, no? That is thought disturbances, no? Then you have perceptual disturbances. Perceptual disturbances are your hallucinations and illusions, no? Your hallucinations are your illusion is distortions of something you see, no? Your hallucination is, there are many things, auditory, no? You can hear things which there is no stimulus. That is hallucinations, no? There are many things, somatic. You feel that you do not have your, I have a patient, he said that, I do not have a heart anymore, doctora. I do not have an intestine anymore. That is somatic hallucinations, no? So there are many, no, hallucinations. So but it would reveal sometimes or most of the time that if you have auditory hallucinations, that is more of some psychiatric problems. Like you have schizophrenia, you have your other schizophrenic form disorder like that. But when you have your visual hallucination, it's more of organic problem. What is, for example, you have tumor, you have had taking drugs. That is more on virtual hallucination. That is a perceptual disturbances. No? So there is no stimuli in perceptual, in hallucination. So there are only two, illusions and hallucination, the personalization. No? Delusion is false fixed belief. No? It is a thought content. That is content of thinking, but it is not a perceptual disturbances. That is content, delusion of grandeur. So I am the president of the Philippines. No? So that is grandiose delusion. That is not perceptual disturbance. Then you have dreams and fantasies. Of course, what are your dreams? No? What do you want to be? No? But it should not be repetitive fantasies, repetitive thought every now and then, until such time that you are already having some obsessive compulsive problem. No? Sensorium, of course. Sensorium counts also in surgery. But alertness, whether the person is just sleeping, the person is having some, what you call that, he would just sleep. When you give pain, the patient will only open his eyes. And then after sometimes she will just go to sleep. No? So alertness, whether the person is alert. When you ask him, he can easily answer. No? Of course, you have also to consider the education. Orientation, of course, whether the person is oriented to time, place, and person. But you have to describe orientation to time. So why did you say that patient is oriented to time? So you have to ask whether now is it morning, noon, afternoon, or evening. No? If they cannot tell the time. No? Concentration and calculation. Concentration is important when you let the patient read. No? Of course, consider also the education. If the patient can read, so short sentence, you ask what he reads. He read. He reads. So you have to consider also the education of the patient, because you might be asking, you might have the patient read, but only to find out that he could not understand. No? Calculation, for example, 100 minus 7 is 93 minus 7, going down. But again, you have to ask the patient's education. Memory, of course, the vivid memory is immediate memory, recent past. No? What else? Past memory. No? Immediate, you let the patient count and let him or her do what you talk, you counted, or you say. No? The recent past, what did he eat in the morning? No? Past, birthdays, so that's important. Then fund of knowledge, you have to ask informational, like for example, is the President of the Philippines, or is your barangay captain, that is fund of knowledge. But also you have to verify that with the significant others. Abstract thinking, I already gave you what is the difference, a ball pen and a pencil. So in abstract thinking, the patient can realize that a ball pen is difficult to be erased, and the pencil can easily be erased. So that's abstract thinking. But usually in a patient who is psychotic, they do not have abstract thinking, but instead of what you call that, thinking, permanent thinking. No? What they see, they will really tell you, the color of the pencil is yellow, the ball pen is black. That's the only thing that they can see. Insight is whether you have your, what you call that, if you have disease, you will go to there to that. Emotional insight, and the other one is emotional insight when you know that you are sick, but you go into treatment. The other one, I forgot the other insight. Does somebody who know that? Intellectual insight, you know even your diagnosis, but you did not go to the doctor, you did not take your medicine. That is intellectual insight. But in emotional insight, you really know what your disease is, and you go to the doctor for treatment. Judgment, when you are given in an imaginary situation. Social judgment, of course, when you are in a party, somebody would ask you to get some food, and would you give them? No. So you have to Would you add? Would you accept? No, if you are given a test judgment when you are in a movie and there is some smoke there, and what would you do? Would you stay there inside? No. Would you go to the CR if there are smoke, or if there is some fire there going on? Would you still stay inside? So there's judgment. You are being asked when you are in an imaginary situation. So those are the things that appear in your medical record. Further diagnostic studies, your physical examination, of course, neurologic examination, additional psychiatric diagnostic studies, interviews with family members, neighbors, and social worker, psychological and other laboratory tests. No? So these are a part also of your psychiatric history or mental status. Then summary findings, your diagnosis, prognosis, whether poor prognosis or good prognosis, no? Then psychodynamic formulation. So what happened? What were the things that you had gone into? What happened when you were growing up? The child had some problem, developmental problem. The parents had pathologic family, for example. So comprehensive treatment plan. What treatment can be given? For example, psychotropic drugs, you will be given psychotherapy. No, so there are many things. Now, it's not only a drug that can be given to a patient, but you can also be given a psychotherapeutic treatment wherein you will be involved. I have already project the different neuropsychological examination to the patient. No? So that would be the end of our lecture. So our examination is, your monthly is when? February 9? And your final, February 9?
February.
And your
Tagline po ang bi-monthly tapos final exam February 10.
Your second quiz. And your February 10 is your finals.
Final exam. Yes
Okay.
po.
Okay. So, yan, align na po ang pag-send. Okay, I will send you the and Thank you very much.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Ayan, nakaon ng pamanata. Ito. Okay na.
Yes. Karon HR din man. Dili pa man laihan na ginhatag.
Okay. Dito ko naman yan.
Sa Sarkat na kayo, di ba? Putabla na January. Ma-request naman luwat kita. May class na pa.
Magiging pa natin